In the modern era of technology and social media, we often forget that celebrities are real people too. They do and experience normal things that every human faces. They also struggle just like normal human beings. All of these celebrities have struggled with anxiety at some point during their lives. Generalized anxiety disorder is something that affects millions of people, including those who are in the public spotlight. People with general anxiety disorder display excessive anxiety or worry most days for at least 6 months about a number of things such as personal health, work, social interactions, and everyday routine life circumstances. The fear and anxiety can cause significant problems in many areas of their life, such as social interactions, work, and school. In the DSM-5, general anxiety disorder is grouped along with other anxiety disorders, such as OCD, which is characterized by recurrent unwanted thoughts and obsessions, as well as compulsions, panic disorder, which is characterized by unexpected, repeated episodes of intense fear accompanied by physical symptoms such as chest pain, heart palpitations, shortness of breath, and dizziness, PTSD, or post-traumatic stress disorder, an anxiety disorder that can develop after exposure to a terrifying event in which grave physical harm occurred or was threatened. Traumatic events that could directly trigger PTSD include violent personal assaults, nature or human-caused disasters, accidents, or military combat. Social anxiety disorder, which was previously known as social phobia in previous versions of the DSM. This is characterized by overwhelming anxiety and self-consciousness in normal social situations. This can be limited to only one type of situation, like a fear of speaking in formal or informal situations, or in severe forms may be so intense that a person experiences symptoms almost any time they are around other people. The final type of anxiety disorder is phobia or specific phobia. This is anxiety about one very specific situation or object or activity. Sufferers know that their fear is excessive but are unable to overcome it without help. These fears cause distress such that people go to extreme lengths to avoid it. Examples include a fear of spiders or a fear of flying. To receive a diagnosis of general anxiety disorder, a patient must have excessive anxiety and worry occurring for more days than not for at least 6 months about a number of events and activities. The individual must find it difficult to control the worry. 3 or more of the 6 symptoms that accompany anxiety must be present, more often than not in the past 6 months. These symptoms are restlessness or feeling on edge, easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, and sleep disturbance such as trouble falling or staying asleep or unsatisfying sleep. Note that in children, only one of these symptoms is necessary for a diagnosis. Additionally, the anxiety or symptoms must cause clinically significant distress or impairment in social, occupational, or other areas of functioning. The disturbance can't be attributable to psychological causes or the substance or other medical condition, and the symptoms and worry must not better be explained by a different mental disorder. All of these statistics are from populations in the United States. 2.7% of adults have experienced general anxiety disorder at some point in the past year. A significant amount more of them are female. Adults ages 30 to 59 make up the largest chunk of the adult population that experience anxiety in a year. 4.3% experience general anxiety at some point during their lives, and about 2% of adolescents experience GAD. More of them are female, and most are older than 15. The impairment of the disorder ranges among the population. 23% have mild impairment, 44% have moderate impairment, and 32% have serious impairment. This can be seen in this graph. Anxiety often coexists with depression, a substance abuse disorder, or another anxiety disorder. These concurrent disorders make the disorder even more disabling than it already is. Anxiety can also cause other stress-related disorders such as irritable bowel syndrome or high blood pressure. The causes of general anxiety disorder are mostly unknown, but it is known that it's highly heritable and can be linked to a stress-filled environment. Biologically, it's caused by the sensitivity of the amygdala, which triggers a stress response in non-threatening situations. Over time, the brain may create its own fears or triggers. In the beginning, GAD will start as cognitive symptoms, such as nervousness or stress, and then progresses to physical manifestations such as insomnia and increased risk of heart attacks and other cardiovascular complications. It usually presents itself in the teen years and can last through the mid-50s, and often occurs in conjunction with other psychiatric disorders such as panic disorder, depression, and substance dependence. The course of treatment for general anxiety disorder is determined by a doctor based on how general anxiety disorder affects a person's life. It often takes a process of trial and error to find the right treatment plan for an individual. Psychotherapy, also known as talk therapy, is preferred by many doctors over medications. It consists of working with a psychologist to reduce and manage symptoms of general anxiety disorder. It focuses on teaching specific coping skills to directly manage worries so that patients can return to activities they enjoy and previously avoided due to anxiety. Symptoms improve throughout the process as you build on your own success. CBT is generally found to be the most effective form of therapy for treating general anxiety disorder. As you can see on this graphic, cognitive behavioral therapy As seen on this graphic, cognitive behavioral therapy by itself causes significant improvement in 60% of children ages 7 to 17 who have general anxiety disorder. Medications can also be used to manage symptoms. There are 3 main categories of medications used to treat anxiety. Note that these medications are not only used for general anxiety disorder. Many are used to treat other anxiety disorders, and some are even used to treat depression as well. SSRIs, or selective serotonin reuptake inhibitors, prevent reuptake from occurring in synapses as quickly, giving the next nerve more time to absorb the serotonin. Serotonin imbalance is believed to be a contributing factor in many anxiety disorders. Common SSRIs include Lopraxo, Paxil, and Zoloft, which was the most commonly prescribed psychiatric medication in 2016. SNRIs, or serotonin and norepinephrine reuptake inhibitors, work similarly but change reuptake of both serotonin and norepinephrine. Effexor and Cymbalta are SNRIs frequently used to treat general anxiety disorder. Benzodiazepines are used in very limited circumstances. These help to relieve symptoms of anxiety but can be very habit-forming, which is why they are used only for severe cases and for short periods of time. They also lose effectiveness after about 4 weeks, another reason this is prescribed only on a very short-term basis. If a patient has problems with alcohol or drug abuse, this drug class is inadvisable as a course of treatment. The most commonly prescribed medication in this category is diazepam. Pregabalin is an anticonvulsant used to treat epilepsy, but has been found to have some usefulness treating anxiety, although it does not fit in the other categories. Buspar is specifically an anti-anxiety medication, while SSRIs and SNRIs are also used as antidepressants. Although on their own, lifestyle changes generally cannot get anxiety under control, they can help when used alongside other methods such as psychotherapy and medications. These include making sleep a priority, getting physical exercise, using relaxation techniques such as meditation and yoga, eating healthy, avoiding substances known to potentially worsen anxiety such as alcohol, recreational drugs, nicotine, and caffeine, as well as attending support groups can all help to manage symptoms alongside other treatment techniques. Lately, there has been a growing use and research of the impacts of mind-body treatments. Treatments that fall into this category include mindfulness meditation, yoga, tai chi, massage therapy, and pranayama. One main reason for increased interest in such techniques is that it makes treatment more accessible to those who choose not to or lack access to psycho or pharmacotherapies. When we were children, we often had fears that looking back on them may seem irrational. However, for Joey, his constant fear of his parents' safety took control of his childhood years. He became frantic if his parents were late coming home, bombarding them with texts and calls. It got to the point where Joey would follow his mother around the house to ensure her safety. After months of psychotherapy, Joey was diagnosed with general and separation anxiety disorder. General anxiety disorder heavily impacts the lives of those who have it, both young and old. It is relatively common in society, and we must be educated about and conscious of the impacts it has on those around us.